Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
It could be the end of public media as we know it. Congress is considering pulling back critical funding that supports stations like Boise State Public Radio. If you care about independent journalism, visit boisestatepublicradio.org/funding and take action today.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. More than 1 in 5 U.S. adults are living with a mental illness, and the need for support is crucial. However, for rural counties, especially across the Gem State, access to these resources is limited, and we do have a mental health crisis here in our state. That's why Southwest District Health partnered with the Weiser Ambulance District to launch a community paramedic program. This is the first of its kind in Idaho to focus solely on behavioral health support. And today, we're joined by Wendy Young, project coordinator at Southwest District Health, and Alan Foster, director of the Weiser Ambulance District, to tell us about this new program that's serving Washington County. I want to welcome both of you to the program.
Thank you.
Thank you.
So, Wendy, to get things started, can you tell us how the community paramedic program came to be?
Sure. About 2 years ago, we were approached by one of the county commissioners for Washington County, and he was telling us about the stress on the emergency medical staff and how they were responding to behavioral health crises. And he was wondering if there was a way we could work together to try to address that need. So that started a bunch of different conversations about how might that need be addressed. And Washington County was very important in trying to decide which direction we wanted to go with this. And they decided that this community paramedic program was probably the best fit for their community. And Southwest District Health then pursued funding, wrote the grant, received the grant, and we were able to start this program as a pilot.
So, Wendy, when we use the term behavioral health crisis, tell us what that means.
Yeah, actually, that's a great place to start because a lot of people use the term behavioral health and mental health interchangeably, and that's completely understandable. But to be really specific, mental health refers to a person's emotional, psychological, and mental health, whereas behavioral health is more broad. So behavioral health includes mental health, but it also includes other behaviors. So it could include things like how a person manages their stress, maybe a person's sleep patterns, or substance use disorder. And so it's a much broader category. So the community paramedic can address a broader range of crises that a person might find themselves in.
So, Alan, from a paramedic perspective, then, how does this program integrate into the crisis response of EMS crews?
Well, we're not as solely focused on emergencies in general now that we're able to approach mental health and substance abuse from a different perspective and truly trying to provide avenues to these individuals and get them the help that they truly need, as opposed to just using different parts of the system to band-aid the problem, like they end up in jail or they end up in the hospital or the back of our ambulance, where we can truly have someone and our entire community now, because we're getting such great buy-in from our police departments, from our fire departments, from our hospitals, clinics, everyone, of truly focusing on helping them with the issue and not just the crisis at hand at the time. So that's our ultimate goal, is to help the bigger perspective of it, instead of just, oh, they're having a crisis at the time, which we're 100% going to help them through and get them the help they need. However, we do want to address that future issue to where we get them the help they can and not necessarily, for lack of better terms, tying up part of a system that doesn't need to be tied up, if that makes sense.
Yeah. So, Alan, with that said, could you give us like a specific, some specific services that this new program will be able to provide to support individuals, like that you and your team would be able to do?
So my community paramedic that's taken on this project, Ashley Lynn, she's done a phenomenal job in educating herself and others, in providing additional training to our staff and the staff of, we're working towards the staff of the police departments, the sheriff's office, the hospitals, anyone who has primary contact with someone in crisis. We can more focus on not only the crisis at the time, but
Hmm.
the follow-up and follow through. Initially, this was just we would have referrals to these individuals to be able to follow up with them if they were identified within our system as needing our help. But now we can not only do that, but we'll be able to do that in a preventative aspect of, we've created a crisis intervention team
Hmm.
within our county now to be able to identify these individuals collectively and be able to reach out to them before a crisis happens and make sure they have the avenues of help and assistance and whatever they may need to prevent becoming part of the system again. So
So, Wendy, why is addressing not mental health and behavioral health? Why is this so necessary, in particular in our rural communities?
Right. Well, Gemma, you've had this on your show a couple of times,
Hmm.
addressing this idea that Idaho does live in an area where there's insufficient access to mental or behavioral health. And across the nation, I think the statistics are now like 1 in 3. A third of our population uh, lives in a federally designated mental health professionals shortage area. And when that comes to Idaho, it's even more drastic. So I think it was last year's Idaho Department of Health and Welfare State of Mind report that they did, and which really identified that Idaho, and especially rural Idaho, has insufficient access to mental health and substance use treatment providers. So this program is one of those ways where we're trying to help fill that gap. We're trying to help people not fall through the cracks.
And I'm curious about, since the program launched, what kind of impact and response have you seen from the community?
we're so early into the development of this program. We're leaps and bounds of where I anticipated us being within this first year. We have seen a couple patients on a acute crisis aspect, but
Hmm.
to be able to give you an accurate impact, I wouldn't be able to do that right now, but just the community buy-in that I've seen has been the most motivating and humbling to see everybody reach out and want to be part of this process. So
Well, and Alan, you make such a good point, right? That the buy-in has been bigger than you expected. You may not be able to put a number on it, but anecdotally, you know that by just being in the community. So, how important is it for community members to be a part of this, right? To take action to help address this crisis?
I think we're only going to be able to make a difference if we have, the most buy-in as possible. If we only have a couple, if it was just my agency as a collective whole, we could make such a small impact on so few individuals. We are very rural. There, the sheer number or volume of people and calls is relatively low, especially compared to Ada County, Canyon County. But I think the impact is going to be bigger because we'll see it more. We'll see the effects more, especially
Mm.
with that bigger buy-in from all the agencies involved.
So, Wendy, for folks who are struggling, or maybe they know someone who needs help, how can they reach this program?
Sure. Well, always when somebody's in crisis, they can call 988, right? So that's
Hmm.
always out there for folks. If they're living in Washington County and they want to get a hold of the community paramedic. Right now, the way I understand it's playing out, it's really referral based. So this is what that big community buy-in is all about. So if somebody's at the hospital and they're presenting with a behavioral health crisis, they can talk to the hospital staff and ask them to be involved with the community paramedic program. If they're involved with law enforcement and they're in a behavioral health crisis, they can ask law enforcement to get a hold of the community paramedic. So that's why Alan's discussion about how the whole community is really working together is so important, because that's how people are going to be referred to this program for now. In the future, we're hoping there will be some self-referrals that people will be able to reach out and have that opportunity to do it themselves. But for now, you really have to go through either like a healthcare provider, a mental health provider, law enforcement, people like that, community organizations.
Yep.
So before I let you go, and Wendy, I'll ask you this question. What do you see when it comes to the future of community paramedicine?
Yeah, this is a really interesting question, because community paramedicine has been around for a couple of decades now. You know, it was initially used and is still mostly used for healthcare concerns. So people say dealing with chronic illnesses, a community paramedic goes out and deals with that in their home, or maybe they're coming out of a hospital and the community paramedic checks up on them to make sure that they're not having to be readmitted to the hospital. And really, this community paramedicine program, where it's focusing on behavioral health, there's only 4 other places in the country that I know of that are doing this. And we've received a lot of feedback and a lot of requests from other places, even outside our state, to find out more about how we're doing this. So I really think for once, Idaho is really on a cutting edge here, and it's Washington County in Idaho who's really on this cutting edge new development.
Well, I appreciate both of you coming in and telling us about this program, and also how well it's being received. We've been speaking with Wendy Young, Project Coordinator at Southwest District Health, and Alan Foster, Director of the Weiser Ambulance District. We've been discussing the first community paramedic program in Idaho to focus solely on behavioral health support, and it's happening in Washington County. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you were going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.